Berardi, and this is my story. It was Saturday, October 10th, 2009, a day I, along with many other high school students, was already stressing over. I was sitting for the first time for my SATs. I knew that the outcome of this day may very well be a deciding factor and major turning point in my life. The results of this test would decide what college I would invest the next 4 years of my life and what career path I would choose. Little did I know that the test I would take would not be as life-challenging as what was to come in just a few hours. I finished the test with a great sigh of relief. The agony was finally over, and I was looking forward to celebrating with my friends by going to the local diner for breakfast. As I reached for my phone to call my friends to see where we would meet, I saw that I had multiple missed calls from my parents. I thought this was strange since they had known that I was taking the test and would not be able to answer at any point during it. Then I saw the text message my mom had sent during the test. It read, "Come straight home after the SATs." Concerned, I called my house immediately, wondering what was going on. My mom answered, and I could already tell something was wrong by the tone of her voice. She told me my blood work had come back from the day prior and I had to go see a doctor in regards to the results. I told my friends I could not go out, that something had come up, and rushed home to find my parents waiting for me. They told me that I had to go immediately to Robert Wood Johnson Hospital in New Brunswick in order to see a hematologist. They also said that I may need to have a bone marrow biopsy because something may be wrong with my blood. My parents rushed me to the hospital, where I was brought to the pediatric emergency room. I found it very odd that I was close to 18 years old, and here I was in a pediatric bed with a Tweety Bird decal on the room door. The nurse went over the simple routine: my medical history, family medical history, height, weight, etc. Then the emergency room doctor came in. She said that the hematologist was on his way, but that she was going to tell me why I was brought here, just flat out say it. She said that my blood work showed abnormal cells and they are 99% sure that I have leukemia. For the next 3 years, but mostly the next 6 months, would be the longest 6 months of my life. Unlike most treatments for other types of cancers, the one for acute lymphoblastic leukemia was intense from day one until the end of the 6 months. There were no breaks, and it was continuous. I traveled to and from New Brunswick to home up to 4 days a week, consisting of receiving intravenous chemotherapy, lumbar punctures, and blood transfusions. While other high school seniors were enjoying their last year of classes and school festivities, I was receiving treatment day after day, fighting for my life. While they were concerned about the classes they were taking, the sports they were participating in, or what they were going to do the next week for entertainment, I was concerned about how sick I was going to be because of medications, my blood counts hitting rock bottom, or contracting an illness that could result in fatality. As you can tell, my concerns drastically differed from theirs. I was forced to grow up and deal with such an immense problem so early in my life, something that most people would never have to deal with ever in their lifetime. People always ask how I've done so much even while undergoing treatment. My answer, which I've found many of other cancer patients and their families, is, it is what it is. You never know what life is going to throw at you, and unfortunately you can never argue or change it. Sure, you can complain all you want, but it's never going to get you anywhere. Every day when I wake up and either going to have treatment that day or feel terrible for medications, I remember that I was given the chance to continue on. I never truly believed that every person has a purpose in life until my diagnosis. Until then, I just thought life was a series of coincidences that occurred and we were in existence just because. But now through my experiences and those around me, I do not believe that any longer. Many people have become my support group through my diagnosis, which would account for my courage. Although sad but true, it was not always the person you would think would be there for you in times of need. A lot of times it was a distant person who wrote a handwritten card and continued to keep in touch even after the diagnosis. It was the family and the community who dropped dinners anonymously, not seeking recognition. It's the group of random strangers who have attended the 4 blood drives under my name and continue to keep in touch for future drives. It was the people who continued to call or visit day after day just to talk. Not about my disease or symptoms, but just talk. These people were the people that gave me hope. It made me realize how much good is actually present in our world. They made the journey that any cancer patient would describe as a living hell that much easier, and allowed for me to see the barely visible light at the end of the tunnel. They gave me the courage to continue on and fight each and every day. I hope that each and every patient out there has the same opportunities that I've had, because of the people around me who have made it all possible. In a way, I see my story as a second chance, a new beginning, and this was all made possible through the kindness and generosity of friends, family, and random strangers. Thank you.